Hey, I'm a psychiatrist, and sometime last year, I had a mental health appointment with a patient who was an Army veteran. They shared with me that they had tried 7 different antidepressants over the past 5 years, and nothing had worked for their depression. Therapy had helped a little bit initially, but they were still drowning. They had felt hopeless, they could not work, and their relationships were falling apart constantly. They were in an absolute deep end of treatment-resistant depression. Then they had one session of ketamine treatment, and 72 hours later, they told me that it was like someone turned the lights back on in their brain. And for the first time in years, they could see a way forward. Now, I'm not saying ketamine is magic. It's not a miracle cure. And this is one patient's story. But the science clearly shows that ketamine works differently than most other depression treatments we have. And that difference is rewiring the brain in ways that we're just starting to understand. So today, I'm breaking down 5 specific mechanisms of how ketamine changes a depressed brain. So, stick around. If you're new here, I'm Dr. J. I'm a medical doctor specializing in psychiatry, and my one goal on this channel is to make mental health make sense for you. Now, before we go further, I need to be clear that ketamine is a Schedule III controlled substance. So please note that this video is educational and not a recommendation to use ketamine outside of medical supervision. If you have questions about your individual health, certainly talk to a licensed medical provider who can evaluate your specific situation. Now, that said, why does ketamine even matter? For one, it's because traditional antidepressants like SSRIs, which include things like Prozac or Zoloft, they work on serotonin, and they usually take between 4 to 8 weeks to kick in. And they happen to work for between 50 to 70% of people. Now, ketamine, on the other hand, happens to work on a completely different system, the glutamate system, and it works pretty fast, like hours to days fast. And for people with treatment-resistant depression, which means that they've tried multiple antidepressants without success, ketamine has shown response rates around 50 to 60+%, and that is huge. But how is this possible? What's actually happening deep inside the brain? That brings us to our very first mechanism, which is where everything starts. And that is NMDA receptor blockade. Now, I know that sounds super technical, so let me simplify it. You see, your brain has receptors, which are like little docking stations for chemicals. One type of this receptors is called an NMDA receptor. They normally bind to glutamate, which is your brain's main excitatory neurotransmitter. Basically, glutamate makes neurons fire. In depression, the glutamate system is often dysregulated, meaning it's not working right. And ketamine blocks those NMDA receptors temporarily, and when it does that, it triggers a surge of glutamate release in other areas of the brain, and that is where it gets interesting. That glutamate surge activates a different type of receptor called AMPA receptors. And AMPA receptor activation triggers a cascade, which means a chain reaction. And this leads to new synaptic connections forming in the brain. Now, synapses are the connections between brain cells. So the more connections we have, the better our brain does at communication and mood regulation. I want you to think about someone with depression. Their brain has fewer synaptic connections in areas like the prefrontal cortex, which is the part of the brain that's responsible for mood, decision-making, and executive function. Chronic stress and depression actually causes connections to wither away, but ketamine kickstarts the process of rebuilding them, and it does this pretty fast too. You see, research from Yale shows that ketamine can increase synaptic density within hours. Yes, you heard me correctly. Hours, not weeks like traditional antidepressants. Our second mechanism ties directly into our first one, and that is BDNF increase. BDNF stands for brain-derived neurotrophic factor. Now, don't let the big term throw you off. Think of BDNF as a fertilizer for your brain. It helps neurons grow, survive, and form new connections. In depression, BDNF levels are typically low, so the brain isn't getting the growth signals that it needs. So neurons end up struggling and connections keep getting weaker. But ketamine triggers a rapid increase in BDNF, and that increase is part of what drives the synaptic growth I talked about earlier. The glutamate surge also activates a protein called mTOR, which then ramps up BDNF production. All of this happens within hours. For example, let's say someone's been depressed for years. The hippocampus, which is involved in memory and emotional regulation, has actually shrunk. You can actually see this on brain scans. And chronic stress and low BDNF are known to cause that atrophy. Ketamine-induced BDNF helps reverse that process by enabling the neurons to start sprouting new branches, forming new synapses, and strengthening existing connections. You see, this is why ketamine's effects can be so rapid. It's actually changing the physical structure of the brain quite quickly. Our third mechanism is one that really separates ketamine from traditional treatments. It's called default mode network disruption. Okay, so your default mode network, or DMN, is a group of brain regions that's active when you're not focused on the outside world. It's the network that's running when you're daydreaming or thinking about yourself or ruminating. In depression, the DMN is often hyperactive and hyperconnected, which means people often get stuck in loops of negative self-talk. They get stuck in ruminations about the past and worry about the future. And the brain just keeps replaying the same patterns over and over and over again. You see, brain imaging studies actually show that ketamine disrupts that hyperconnectivity. It temporarily quiets the DMN, and that disruption creates a window where people can step outside their habitual thought patterns. Now, I want you to think about someone who's been telling themselves, "I'm worthless," for 10 years. That thought pattern is deeply ingrained. It's almost like a highway in the brain. It's super reinforced and it's incredibly easy to travel all the way down. Ketamine, on the other hand, temporarily makes that highway less accessible, which gives the brain a chance to form new paths. Patients often describe this as feeling like they can see their thoughts from a distance, like they're not so fused with the negative narratives that they've had spent so many years replaying. And that psychological space is when therapy can really start to work. And that's when new perspectives become possible. Our fourth mechanism is one that's getting a ton of research lately, and that is anti-inflammatory effects. Now, depression just isn't a chemical imbalance. There's actually growing evidence that inflammation plays a huge role in depression. People with depression often have elevated inflammatory markers in their blood, things like interleukin-6 and TNF-alpha and C-reactive protein. But here's the thing, that inflammation actually affects the brain. It disrupts neurotransmitter function and interferes with neuroplasticity, which contributes to the brain fog, the fatigue, the general physical symptoms of depression. But ketamine has anti-inflammatory properties, and studies show that it reduces inflammatory markers. And that reduction actually happens quickly, within hours to days of administration. So for example, let's say someone has depression that's been resistant to multiple medications. You test the inflammatory markers and find that they're elevated. And this person might be dealing with what some researchers call inflammatory depression. Now, some researchers think that ketamine's anti-inflammatory effects could be part of why it works when other treatments have not. And this also connects to the immune system. You see, chronic stress activates the immune system in ways that promote inflammation all over the body. And ketamine also seems to interrupt that stress inflammation cycle all over the body as well as the brain. Our fifth mechanism is the most controversial, and this is the dissociative experience itself. Now, ketamine is classified as a dissociative anesthetic, and at the doses used for depression treatment, it causes what people describe as feeling disconnected from your body. Some people feel like they're floating, and some folks have visual or perceptual changes, things like that. And for a long time, researchers debated whether that dissociative experience was necessary for the antidepressant's effect, or if it was just a side effect. And the answer seems to be that it matters. Studies show that the intensity of the dissociative experience during the ketamine administration correlates with better outcomes. So basically, people who have more intense experiences tend to have stronger and longer lasting antidepressant responses. The theory on this is that dissociative states create a psychological window. It disrupts your normal defenses and your normal narratives, and it allows you to process information or memories that you've been avoiding or just can't access in your normal state of consciousness. I want you to think about someone with trauma-related depression. They've spent years avoiding feelings connected to that trauma, but during a ketamine session, those defenses might soften and they might access those feelings in a way that feels safe because they're somewhat disconnected from their usual identity. And that processing, especially when supported by therapy, can be deeply healing. But, and this is super critical, that's why ketamine therapy isn't just about the drug. The therapeutic support before, during, and after the session is what helps people integrate the experience and make lasting change. So, let's put this all together. Ketamine blocks NMDA receptors, which triggers a glutamate surge, which activates BDNF production, which drives rapid synaptogenesis. It also disrupts the default mode network, breaking rumination loops. It reduces inflammation, and the dissociative experience creates a psychological window for processing and change, especially with therapy. Now, all of these branches are working together, and that's why a lot of researchers think ketamine can work for people who've tried everything else with little to no success, because it's hitting multiple systems simultaneously, and it's doing it pretty fast too. Now, it's also important to note that ketamine is not a magic one-time bullet. Most people need multiple sessions, typically 6 to 8 sessions for an initial course, and the effects can wear off, which means some people may need maintenance sessions. It also doesn't work for everyone, and about 30 to 50% of people with treatment-resistant depression do not respond to ketamine, and we don't fully understand why just yet. On the other hand, if someone has a ketamine session but doesn't address the underlying patterns of the condition through things like therapy or lifestyle changes or richer, more dynamic support systems, the depression often comes back. So ketamine is best thought of as a catalyst. It creates neuroplasticity and opens a door, but you still have to do the work to get through that door. In terms of who ketamine therapy helps the most, research shows the best responses in people with treatment-resistant depression, especially those with suicidal ideation. Ketamine has been shown to have rapid anti-suicidal effects, which can be life-saving. Ketamine is also being studied for things like PTSD, OCD, and anxiety disorders. So make sure to subscribe and look out for videos on those conditions and their treatments as well. Now, if you found value in this video, then drop a comment with one thing that stuck out to you or any lingering thoughts you have about ketamine therapy. I also think you will like this video right here, where I explain 5 important depression signs in under 10 minutes. It's a quick but highly helpful watch. In the meantime, I'm Dr. J, and I appreciate you for watching. I will see you in the next video. Take care.